what exactly did you see when you were shopping, and what has differentiated this organization in your mind as a vendor that you use? Is that clear enough?
Yeah. Can you hear me?
Yeah, great.
Okay. Real simple. I've worked with Pat since I came to Altoona, and it was healthcare. It was all based on healthcare and ways to save money. Now, understand the Altoona School District, we're we're running a negative budget. We're in a deficit situation every year. So saving money is crucial. And saving money on healthcare is extremely important considering we have 1,200 employees, of which about 850 to 875 actually are on our healthcare plan. Um, it was a traditional plan. It was straightforward. You buy the blues, you deal with their primary care physicians. I mean, we were with UPMC, which is another version of a regional blues kind of thing, and it's a locked network. To that end, we talked about People One and what People One could provide. People One gives us basically 90% of what any person would normally need, excluding some major tragic tragedy or situation where you need major medical. People One provides everything from prescriptions, doctor's visits, consultations, telemed, virtual visits, and it gives you all the second tier of all your specialties when you're talking about when you're talking about outpatient surgeries and what do you want to call it, when we refer patients, or when patients are referred from the primary care physician to the next level. We looked at them and we looked at it from the standpoint that if we saved, it was going to cost us up front. It was going to cost us a monthly fee. But for every so many people, I mean, we have about 200 people that are with People One right now, or 200 plans or families that are with People One. If it keeps one of those from turning into a major medical issue, it saves us more than what we have invested. In time, we started the process of developing the community partner network, which was primarily based off of Zane Gates's People One model, and creating a network where it's no longer the PCP sending us through the only one provider's system. Because with UPMC, you went to a UPMC PCP who recommended you to a UPMC specialist who, if they did the surgery, did it in a UPMC hospital. And all the time, they controlled all the costs and they controlled all the points of service. And basically, they made every penny they possibly could in the process. So now we've created a network through Zane's help and through an amalgamation of different sources like AMPS and Preferred Healthcare Network. You know, we use these different sources, and we've created a partnership with Nason and Conemaugh Health, which are two local regional providers, a local regional provider that affiliated with each other. Penn Highlands, which runs a string of local hospitals and regional hospitals. We also have a huge partnership with the Allegheny Health Network. And one of the reasons we landed Allegheny Health, it was because Zane went out on a limb and basically sold it to them as, this is your chance to get a market from an area where you don't see any kind. Cost has nothing to do with quality of care. Creating a system where the best independents are available to all of our employees is huge, because on one hand, I have University Ortho run by Josh Port, phenomenal orthopedic, handles ACLs, MCLs, you name it, orthopedic. He's king. He is nationally known for the quality of his work. On the other hand, I have a provider from UPMC called Elite. The difference to me is if I can get an employee to go to University Ortho, an ACL will cost me approximately $5,000. If I send an employee to Elite, that same surgery is $15,000. And you can imagine, as an employer, I'm giving them the same quality, if not better, healthcare, but I'm saving the company, myself, 2/3 of the cost. And that's
What
you being able to provide care and continually provide care to all of my.
Jordan, can you, I mean, I think it's a perfect segue. Can you describe the model that you're deploying, and how you've gotten to these kinds of results?
Thanks, Brian, and thank you, Dr. Prietel, for your leadership. You've always been out there advocating for your people and for the community. For Dr. Prietel is actually 5 years into this journey. He's partnered with us to really build multiple layers of this. But I'm going to give a quick rundown and use a couple of visuals that'll help put some form to kind of the pieces of the puzzle of the advanced primary care model, and actually much more that Dr. Prietel has helped to champion. So just a visual or two here. So just from a theoretical standpoint, this is really what we set out to accomplish. And bear with me while I just pull this up, everybody. So it just said in a statement, we felt strongly that if we are going to attack the challenges in the healthcare system, we needed to remove a large percentage of the claims, just like Dr. Prietel was saying, from those PPO networks. In our model, it's 85 to 90% of all the frequency happens outside of PPO networks, not within fee-for-service and outside the insurance claims process. And what we allow our partners like Dr. Prietel and the school districts to do is directly purchase all of that, and then build a health delivery model with Dr. Gates around that transparent per member per month pricing model. So this is in a snapshot what it looks like. We actually, as People One Health, are the primary care providers, the clinical teams, the office. Our members have unlimited access to care. The Altoona Area School District members have, just like Dr. Prietel, your yearly checkups, your urgent care, your chronic disease management. But you're also going to have a registered dietitian, a licensed clinical social worker, a clinical pharmacist. You have this entire care team surrounding you to help you support, prevent disease, manage whatever condition you have in a robust way. So nobody's forced into the People One Health model. They get to choose it. I want to try the People One Health model, or I'm going to stick to, kind of what's more traditional. So year after year, we get to track how the clinical and financial outcomes are for the folks who we manage versus the folks who stay with the PPO. And you see the orange bar and the blue bar, and it's a dramatic cost saving. So yes, we're going to do more, Brian. We're going to look for bundled episodes of care. We're going to look for a way to directly contract the entire health delivery system. But already Dr. Prietel has brought 20, 30, 40 plus % savings to his folks. So there's more to come, but we can already do a whole lot of great stuff for Dr. Prietel.
Jess, can you comment on, you've been in the enviable position of sort of watching this thing unfold and being able to convey to the members of your coalition that this is happening. What's been the response by other members of your coalition?
Good question. For the first one, my introduction to People One Health or Dr. Zane Gates was a reporter from the Post-Gazette who said, Jessica, there's someone in Altoona who's shaking things up, and you two seem to be from the same place, the same planet. I think you need to connect with this guy. And that's how I ended up getting connected. And really what they meant was there's a huge system here, big players in your marketplaces that don't seem to be touched or challenged very much. And somehow you two think you're a little bit crazy enough to do something about it and say things and create things that others aren't. I heard from one of my team members whose wife hadn't stepped in a doctor's office for 2 years, diabetic, because she lost faith and trust in the system. Felt that she was dismissed, ignored, it caused more trauma to go get care than it was to avoid it. And I got a text by the end of February because his wife went schedule her appointment with People One Health, which is no cost to them. we cover as a small company, we cover 100% of their fee for the People One Health services. And we still maintain our percentage, 80% coverage of their insurance plan. And her diabetes is now being managed. She actually looks forward to going to the doctor. She feels heard, and he's at peace. He sees the doctor. He's like, I'm getting help too, but I'm like, this is really, my wife is happy. That makes me happy. And she's healthier. And to be an employer that's able to contribute to that. So that's at our micro level. And then at a macro level, to now say, I have my board member saying, I want to do that. Like, I wish I can. And now the answer is, well, you can. You have to be able to build it. And I think the quality versus equity change in language that we're having in healthcare now is helping with that. Is why can't you start here in Western PA and build with People One Health or your type a partner that you've identified as the right partner for you? Why not?
The answer is yes. Are we going to see more adoption? Yes. Why? Because we're running out of a choice. We're getting to the point where there's no choice. And so they're going to run to the value. However, they are wringing out, for the most part, not everyone, wringing out status quo as much out of it as they can get. And I think the differentiator can be, and what will expedite this is the role of the consultant that they rely on. And I do think the CAA, the Consolidated Appropriations Act, can, as a fiduciary responsibility, and if that really gets off the ground, because many are still ignoring it as if it doesn't exist. But if that gets off the ground or gets leveraged appropriately, and employers see that as a tool for them, as compared to something else. Sorry, I'm in the car. Good music. Hopefully you're enjoying it. But if they see that as a tool for them to get value and hold their partners accountable, I think we're going to see an accelerated level of adoption of solutions like People One and other primary care, advanced primary care options. So this isn't only like let's save money as employers, help them add value and healthcare value to our employees. This is literally an opportunity to not be irrelevant in the future and not be on the wrong side. And so I just encourage folks, especially employers, to wake up, look at what this time is calling for, decide to stick with something, and create a partnership that truly is aligning with your values, your missions, and more importantly, the values and mission of your employees.